we now have our special guest.
Dr. Rafia Miah, welcome to the
Hi,
show.
thank you for having me.
You're welcome. How are you?
I'm good. I've just moved to Birmingham to start my new job, so I've just been settling in,
How's
but
Birmingham? How
everything's
you, how
good.
you finding it?
It's good. I love it. I'm so happy here.
I really like Birmingham. It gets a bit of a bad rep because of the accent.
I don't know why. I quite like the accent.
Same,
Really?
same. I
Yeah.
always say this. I think that Birmingham accent's perfectly fine. I don't know why people hate on it.
One time someone said, "What's better, the Birmingham accent or silence?" And they chose silence.
No, I really like it here. I chose Birmingham actually because I wanted to be in a more diverse area because I came
Yeah.
from Southampton and I'm so happy here. It's so nice to see so many different types of people.
Yeah. Definitely in terms of like the diversity of the city, it's sick. Like, especially like, like
Yeah,
Small Heath and Allen Rock. Like, have you explored around those areas yet?
a little bit. Yeah, it's so good. I'm just so happy to be in like a bigger town
Bigger
with
city,
so many
yeah.
more people. Yeah.
Yeah. Well, I'm glad you're settling in. You should. Have you been to Manchester?
No,
Have you visited Manchester yet?
no, I've never been, but hopefully one day I'll come up.
You definitely should because it's very. I'd say it's like they're very similar vibes. Like very
Yeah,
similar vibes. It's
Same but different,
same but
isn't it?
different.
Yeah.
Yeah, better accent.
yeah.
I mean, that I'll agree on. Yeah, fair enough.
So Rafia is a doctor. And I've seen you're working on like the COVID wards. How is that?
Yeah, so I just started officially last week, and I started on nights, which has been a little bit rough.
Oh God.
But yeah, I am on the COVID ward. It's actually my first time working on a COVID ward, but I think this time round, because now that everyone's been vaccinated,
Mm.
it's very strange because the people you see in hospital are actually mostly young people.
Yeah, I've
Um,
heard.
90% are unvaccinated people.
Oh,
Um,
crazy.
and you really see like how important it is to get the vaccine. And how a lot of people I think have sort of thought that, COVID doesn't really affect young people.
Mm.
We're young, we're healthy, we're fit, but it can be like there are people on the wards who are perfectly healthy, like marathon runners who
Mhm.
just end up having a really horrible case of COVID.
That's
Um,
crazy. That's such a
so
baptism.
that's been very strange.
It's
Hmm?
and it's such a baptism of fire as well. Like to have just
Mhm.
graduated, like it's your first placement, and they just drop you right in the COVID ward in a big city.
Yeah, it has been a very steep learning curve, but it's been good. Like I'm really happy to be there, and I think like a lot of being on the COVID ward because there's not much you can do is just to spend time with people because people have been
Mm.
there for months and months and
Oh,
months, and so they're
crazy.
very lonely. Honestly, the best thing you can do for a COVID patient is just to spend time with them.
Really?
Um, Yeah, I think it's really rough for people that have been in hospital, and I think only when you really because when you're outside with the easing restrictions, you can't really tell that we're definitely in
Still
another
in a
wave.
pandemic, yeah.
You definitely can't tell, but when you go into hospital, you're like, we're still in the deep end.
That's
Um,
insane. That is so
Hopefully
insane.
things will get better. Yeah.
So, Rafia has joined us today to talk about an initiative that I think you run it. You run it, right? Did you find it as
Hmm.
well? Were you?
Yeah, I did. I did.
Okay, so Rafia has found and runs an initiative called Amar Doctor, which I just explained means my doctor in Bangla. Do you want to just
Mhm.
kind of like speak off your own back, tell us about that? How did it start? Like, we just want to know what it is,
Sure.
what you guys do.
Yeah, of course. So I'm Bengali myself.
Big up, big up.
Yeah. And so I've always really been interested in Bangladeshi immigrant health because I
Mhm.
think that's like um, I mean, it's an underserved community,
Right.
especially in the UK. And so I've always been, and I'm also very interested in women's health, and I've always wanted to do something in that field, but it's hard when you're a student, there's not much you can do. I was just a medical student.
Mhm.
But then I've been working with another organization called Health Pioneers. Look them up, they're sick.
Okay.
They basically work to empower young people in East London. So this is like mostly teenagers and kids that live in East London. And we do like a mentorship scheme to help kids get into university for medicine or dentistry. And we do like other sort of projects to kind of get kids thinking about how they can serve their community. So we encourage them to come up with like a health project
Mhm.
and to work on that. And we do all sorts of different schemes like ones with nutrition, getting into university, things like that. So they mostly work in East London, but we're trying to branch out to further out in London as well. So I was working with them, and I was kind of just talking about how I'm interested in doing something with women's health, and they were like, "You should just do something, and we'll support you." So they Health Pioneers really helped me start up the project,
Mhm.
as well as another organization called ASTOC, which works in health education and making educational videos in different languages.
Oh wow.
So they'll have like a video on, for example, the COVID vaccine, but it will be in like Gujarati, Punjabi, Malay, Hindi, like Somali, like loads of different types of videos, which is
Mhm.
really important because not everyone speaks English, of course. With their support, I started up a project called Amar Doctor, which, like you said, means my doctor in Bangla.
Mm.
And it's focused on Bangladeshi women's health, specifically. So we do educational workshops, so they're online on Zoom on different health topics, and it's run by female Bangladeshi healthcare professionals. So doctors. We've also had like a virologist talk about the vaccine,
Mhm.
which was cool. Our main doctor that does it is a doctor called Dr. Farah Farzana. She's amazing. She's actually based in Manchester, Bolton area.
Way.
Um, she's amazing.
Oh wow.
Um, so we do these videos, and we encourage Bangladeshi women to join.
Mhm.
And we started up slowly. So we did different videos so we do relevant health videos for them. So we've
Mhm.
done it on like breast cancer, which is
Mm.
like a taboo subject. So it's kind of a difficult topic in general. We've done like domestic violence, mental
Wow.
health, the vaccine, different types of cancer. And over time, we've kind of grown a community of Bangladeshi women to start, thinking about their health and trying
Mhm.
to encourage them to prioritize themselves.
Mhm. Mhm. Mhm.
Because the one really shocking statistic that I found out was that Bangladeshi women, it's one of the only communities where women have a lower life expectancy than men. And that just is universally not the case because men tend to die before women for a number of reasons. But for
Wow.
Bangladeshi women, because we don't prioritize our health at all because,
Yeah.
they
They're
think
so
about family
self-serving.
and
Yeah.
completely it's like a cultural problem that
Mhm.
women die first.
Wow.
And so I wanted to do something that's focused on women because
Mhm.
there's very little that Bangladeshi women kind of do for
Mhm.
themselves, and I want
Yeah.
to kind of change that mindset.
Yeah. 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 Yeah.
Yeah.
It's crazy. Like everything you're saying is just resonating so much because,
Mhm.
uh, like you're not from the UK, are you? Like you didn't grow up
No,
in the
no,
UK, no. Um,
no.
so like this is, I mean, to be honest, I don't even think it's specific to the UK. I think it's just like a very universal Bangladeshi woman thing, right? Like you're talking about how
No.
they're just so not self-serving at all. Like they don't look after themselves. They're so self-sacrificial. Um,
Yeah.
so I think like it's amazing that you've done this initiative.
Mhm.
Um, I just want to ask, when you were starting up, what were like some of the kind of barriers to what you were doing? What were the difficulties in doing that?
So the one thing is that I'm not from here.
Okay.
So I found it a bit difficult to find women, and I don't have any family in England either. So I
Ah,
was
okay.
finding it a bit difficult to find the women that I wanted to get to. And obviously, we use social media, we use Twitter,
Mm.
but the Bangladeshi women in need that need these services are not on Twitter, they're not on Instagram.
Mhm. Mhm.
Um, so when I first started out, I kind of just reached out to different uh, Bangladeshi healthcare students, so mostly medical students. And I
Yeah.
was like, can you try get your family engaged, your social circles engaged?
Yeah.
We reached out to a couple schools. And for example, there's like I think she's like a year 12 student who's in a local school in East London.
Yeah.
And we kind of trained her to become sort of like an ambassador for the program to,
Oh wow.
reach out to her friends and her friends' families, because I think that's the best way to
Mhm. Mhm.
access the people and
Yeah.
tell them that we have this free program, please join.
Yeah.
And the other thing that was difficult, and I was sort of hesitant about starting this whole thing, was because it was online. So I started this in August 2020, when we're in the middle of a pandemic.
Wow.
um, and obviously everything, ideally it would be face to face, but because of the pandemic I had to
Mhm.
do it online, and that's a whole nother barrier itself,
Yeah.
because um, I mean, a lot of Bangladeshi women are not used to using a lot of digital platforms like
Mhm.
Zoom, and sorting that out. So that was a bit difficult, and I thought, no one's going to come. But actually, even if you have never used those sort of platforms, after you do it one time, you learn how to do it.
Yeah, that's true. That's true.
And in the middle of a pandemic, when everyone is so isolated, if you
Mm.
know how to use Zoom, like a lot of, for example, this like 75-year-old woman reached out to me and she was like,
Wow.
I don't know how to use Zoom, but if you can just teach me, I would love that, because, there's a lot of like Islamic courses online. She was doing
Yeah.
like a fitness class on Zoom
Oh
as
my
well. She's so
God. Big up auntie. That's sick.
yeah, so once you learn, so a lot of these women, they just ask their like grandchildren or their kids to help
Yeah.
them set it up. And
Yeah.
once they like learn how to use it one time, then they could join every week. And
Yeah.
that's kind of how it happened. So not only did we try and encourage people to start thinking about their health, but we're also like, oh, you should learn how to use Zoom and things
Mm.
like that, because then
Mm.
you can keep up with what's going on in the world.
Well, okay, so you know how you're saying obviously one of the barriers was they weren't aware necessarily in the beginning of how to use these platforms.
Yeah.
Were the people in the community like responsive to this initiatives? Because obviously we know that Bangladeshi women generally are very self-sacrificial anyway, and like in my experience, they can sometimes be quite flippant about their health, so not necessarily like they just don't see it as that serious.
Yeah, so that is obviously a problem. But the women that started to join, you can tell that they were curious to learn and they
Okay.
were a little bit interested to learn.
Mm.
And while we do talk about different topics, like throughout the sessions, especially Farah, Dr. Farah, she constantly tells women like you need to start thinking about this stuff. Like this is really important. You should look after yourself.
Mhm.
And I mean, everyone does to a certain extent want to look after their health because they want to make sure that they're around for their kids, for their
Mhm.
families. And so we kind of have started to encourage people to have this sort of mindset. And also the way we do it is that we have this like because obviously not everyone uses email.
Yeah.
So we have created like a WhatsApp group chat sort of,
Mhm.
where women join, and we send the link out there, and we send out these flyers that are in English and in Bangla, to women about each session. And because there's like a WhatsApp group, it feels more like a community.
Yeah.
And over time, you see the same women coming to the sessions. I mean, they'll be like once a month.
Mhm.
And it's so nice to see familiar faces because you know that there's an interest. And we
Mhm.
tell
Mhm.
people a lot in advance so that they can rearrange their plans and attend. And we try
Yeah.
and make it, not clashing with prayer time, for example.
Oh. See, that's it's
But
so
yeah,
important.
it is
Like,
difficult.
it's so important to get like someone from the community to actually do something like this because I know, like for example, the NHS have tried to do certain initiatives. Like I've seen, like translated videos, for example, like informative videos and all that kind of stuff. But an initiative,
Yeah,
like for example, you just said something that like could be dismissed very quickly, okay, we try to make sure that it didn't clash with prayer times, but someone not from the community or someone not like from the religion even would overlook something like that so quickly, right? There's so many like
yeah.
cultural specificities that need to be taken into account when you're serving a community that,
Yeah.
as you have said, have been underserved for so long. um
Yeah, I mean, it's also like a trial and error. Like the first time, I didn't even think about like the time. We just set a specific time, and then after
mm,
each session, we try and get feedback. And one of the women was like, "Oh, actually, I couldn't go to the other half of the session because I had to go pray." And I was like, "Oh, we should make sure that it doesn't
yeah.
clash with prayer time." And then the other reason that I think that women are more keen to join is because it's led by a woman, and we
Yes,
only allow
definitely.
women to join, so there are no men that attend.
Hmm.
And we do, so it's not just like a video, for example, is just you just listening, but you
It's
can't
not
have a say.
interactive, yeah.
Whereas we have like, so we do our session and then for half an hour or however long it takes, we do like a Q&A session.
Mhm. Mhm.
And so women can specifically directly ask questions to the doctor.
Mhm.
And I think that's the most effective and
Mhm.
important bit of our
Mhm.
session. I
Mhm.
mean, the educational part is good, but a lot of women just ask questions that otherwise they would not never ask their GP. They would
Mhm.
never ask a non-Bangladeshi person, and they would never
Yeah.
ask someone who's not a woman. So I
Yeah.
think that's the best part that we have that kind of keeps women coming.
That the trust, right? The trust and the familiarity, like the kinship.
Yeah,
That's
definitely.
amazing. Um, I
Yeah.
wanted to ask about, so obviously you've said part of the reason why this came about was because you were looking at like the statistic that you said that Bangladeshi women are, they die, they have a lower life expectancy than their male counterparts. And specifically in the UK, the Bangladeshi community are very, as you've said, underserved. We are like, I think we have one of the highest rates of poverty. Like the community is very, very like kind of impoverished, let's say. And in
Mm.
general, because you specified you focus on Bangladeshi immigrant women, right? So, and this is me just
Yeah.
kind of generalizing, because obviously it's not the case for everyone, but women are also not generally taught about healthcare when they're in Bangladesh. I remember like there was one time I was in like this village clinic and there was this woman and she was pregnant with her fifth kid, and she didn't know that sexual intercourse is what creates a child. She was literally
Yeah.
pregnant with her fifth kid. It's crazy. So
Yeah.
doing these workshops, is there anything that like really stood out to you in terms of like the kind of nature of health education within the Bangladeshi woman community? Like, is there anything that was super shocking to you, or anything that you've identified as a further problem that needs addressing?
So I think, I mean, at first this comes from a completely naive perspective because I
Mhm.
didn't grow up here.
Yeah.
I was so shocked to see like the level of deprivation of
Right.
Bangladeshis here.
Right.
Because if you really think about it, our parents, our grandparents are immigrating from Bangladesh and they're moving here.
Mhm.
And we're associated with, like you said, like so many negative statistics, like
Mhm.
some of the most like impoverished people,
Mhm.
a highest rate of overcrowding, highest rate
Mhm.
of child poverty,
Yeah.
all of these things. And I was thinking to myself, like, imagine our parents are like leaving their friends, their family, everything they know, and probably a better standard of living, and
Mhm.
moving to this country where they now have to deal with all of this
Mhm.
just for better education and job opportunities for their kids.
Mhm.
And if you see like the gap between our generation,
Yeah.
so a lot of young Bangladesh, I mean, obviously not this is a complete I mean it's not for everyone,
Yeah.
but a lot of us have like higher education,
Yeah.
multiple degrees,
Yep.
doctors, dentists, all of this. But then our parents are dying early. Our parents are getting all of these preventable diseases. And there's this big gap between our generation where we're, fluent English speakers, extremely educated, good jobs, things like that, but then our parents are kind of being left behind, specifically our mums. So that I think was something that was a red flag to me. And then
Mhm.
when I looked at Bangladeshi women's health, there's almost no research on it. I could not find anything, maybe like
Really.
one paper from 1991. And I was like, we are such a big ethnic community here, ethnic minority community here, and there's very little research on our health, which doesn't
Mhm.
make sense, especially
Mhm.
when we're suffering the most.
Mhm.
And
Mhm.
in terms of like things that kind of surprised me during the sessions is I mean, it's just things that you think everybody knows, and it's just not true. Like you kind of become aware of like the basic level of knowledge people have about health. And it's
Mhm.
maybe for me, again, from a naive perspective, because I have a healthcare background, these are things that I thought that, it's just everybody knows, but it's just not the case. Like you said, that woman wasn't aware that sexual intercourse leads to pregnancy.
Mhm.
Things like that happen all the time. Like a lot of women don't understand the concept of a period. And then a lot of these stigmatized topics, anything to do with sexual health,
Mhm.
anything to do with,
Mhm.
gynae health, that sort of stuff is never talked about.
Mhm. Mhm.
Even the fact, like, even when we did our breast cancer session,
Mhm.
we were encouraging women to self-examine. And that was a difficult topic to talk about because
They're just
women just,
ashamed,
they
right?
don't do that. Yeah.
Yeah, Like the concept of bodily shame with Bangladeshi women is crazy. Like I
Yeah.
see it with my mom all the time. Like her sense of bodily shame is insane, and like I have to try really, because like I feel like my little sister. She's my younger sister. She's 12, and sometimes I see her like inherit my mom's sense of like bodily shame. For example, like if I'm at home, she'll walk around after me like covering me up if I'm wearing like revealing clothing or something, and I'm like, babe, it's okay, it's okay.
Yeah.
Like it is crazy. And I think as well, like we're talking, like if we're talking about, UK, like British Bangladeshis, we have to also speak specifically about Silitis, right? Because Silitis make up
Yeah.
like 90 something percent of the British Bangladeshi population. So for those of you at home who are not Bangladeshi, Silitis are basically like, we're from the northeast of Bangladesh, so it's like a specific region that we're from, and we have like our own language and stuff like that. And it's very, very interesting to see the ways in which like the like regional context here in the UK mirrors like the national context back in Bangladesh, because also in Bangladesh,
Mhm.
Silitis are quite like like education rates are not that high in Sylhet, from
Mhm.
what I understand. And obviously these are the people often, so the reason why Bangladeshis in general are not that well off, like are one of the poorest ethnic groups in the UK. I think they are the poorest ethnic group actually, with in
Yeah.
line with Black Africans, is because the immigrants don't come from wealth. So the immigrants
Mm.
don't come from wealth. They literally come from impoverished backgrounds in Bangladesh to impoverished backgrounds here. So this idea of like health education is just completely alien to them, like in the first place. It's not as though like they had it and then they came here and they lost it. These
Yeah.
people just they don't even understand the concept of health education in the first place. So I can understand like why it would be such a huge task, like such a big thing to
Mm.
tackle. Um, but I think like that's also why it's like obviously super important to do it.
Yeah. And you see like so many important diagnoses just
Mhm.
missed in women specifically. Like, for example, in various cancers, there's like
Mhm.
lots of things you should look out for.
Yeah.
So, red flags for any sort of cancer would be like weight loss, would be night sweats, would
Yeah.
be changes in your bowels, just feeling unwell.
Yeah.
And these are sort of things that would be completely disregarded by women.
Yeah.
People don't go to the doctor, especially Bengali women, unless it's like a complete emergency, which is a shame
Right.
because it's free here. Like
Right.
they're there to be there for you whenever you need it. But women just will not go at all. And that's why these sort of things are so underdiagnosed completely. Like, for example, I
Mhm.
saw this woman right after I started this project. I saw this woman in hospital,
Mhm.
and I was working in like the liver ward, sort of, which is
Mhm.
mostly like alcohol related stuff. And I saw this Bangladeshi woman, which was so strange because she clearly does not drink alcohol, and she was
Yeah.
there.
Yeah.
And the reason she was there, imagine she has been in this country for 50 years. She's not
Mhm.
registered with a GP. She's never been to
Wow.
see a GP. And she had a type of liver cancer as a result of
Wow.
having a hepatitis C for over 50 years. So in Bangladesh, she got
Oh
it
my God. And it's been
while she,
undetected for 50 years.
undetected for 50 years.
Oh my
And
God.
she got it sometime in Bangladesh in her 20s,
Oh my God.
most likely like during labor or something like that.
Mhm.
And 50 years later, she's now suffering from something that could have been completely prevented if
Oh
she
my
had gotten a
gosh.
blood test by her GP, for example. And it's
Mhm.
so frustrating to see her there because she's there with a preventable disease. She's not speaking the language.
Mhm. Mhm.
She doesn't want to be in a ward where maybe she doesn't feel like her modesty is completely
Yeah.
respected. She has trouble with eating the food there, with understanding what the doctors are doing, with giving
Mhm.
consent to procedures, things like that.
Mhm.
And you
Mhm.
think to yourself, like, no wonder people don't want to go to the hospital because,
Yeah. It's such an
if you're
alien
not
thing. It's such
around,
an alien thing to them. They're so afraid because they don't know what to expect when they
yeah,
get there. That's
yeah.
crazy. So we've just been obviously talking about Amar Doctor and Bangladeshi women. I wanted to talk now a little bit about how Because obviously we were speaking about the reluctance that Bangladeshi women have from themselves to go and see doctors and seek medical attention. Now working in the NHS, I wanted to ask if you could offer some kind of like perspective on. I don't know if you've ever heard of like Miss BB syndrome.
Yeah, I've heard about it.
Yeah.
So it's kind of, is that the generalized pain that's um a lot of doctors kind of disregard as a mental health
Right,
problem?
right. I think, and yeah, and
Um,
I think it's just like basically a lot of South Asian, especially like older South Asian women that go and just get dismissed basically because the doctors are like, oh, they're just dramatic by nature, that's just their culture. They're just dramatic or they're exaggerating or they just don't take it seriously. Which I mean, that is not even specific just to Bangladeshi women. Obviously they do it a lot to like black women as well or like South Asian women at large, like because of course we know the NHS is, in my opinion, so this is radio, we have to say
Yeah,
things
yeah.
like, in my
Allegedly,
opinion. We have
allegedly.
to say allegedly, because we're going to get in trouble by Ofcom. But in my opinion, allegedly, the NHS obviously is racist, much like, every other institution in the UK. From your like obviously experience as a Bangladeshi like woman doctor especially, like how has that been for you, like going into the NHS and like.
yeah, I mean, I think it's a thing specifically with women and non-white women. So
Mm,
there's some sort of, I don't know why, some sort of stereotype that um one that non-white women kind of exaggerate their symptoms or
yeah.
exaggerate their pain, which is crazy to me because the fact that they're even there
Mhm.
saying that they have any symptoms is a big thing because they have to overcome so many obstacles and
Yeah.
reluctance and all of these things to even access a healthcare service. So the fact that they would be disregarded after getting there is very frustrating. But there's kind of this sort of idea that they maybe exaggerate their symptoms or that they feel less pain. So, for
Mhm.
example, recently there's a study that said that Black women are 4 times more likely to die in labor than white women.
Mhm.
Um,
Mhm.
and a lot of it has to do with their symptoms being disregarded. And
Mhm.
there's some sort of idea that, for example, Black women don't have stronger pain threshold, which is
Mhm.
obviously completely false
Mhm.
in every single way.
Mhm.
So, I mean, there's lots of reasons. I think, I mean, for the most part, healthcare professionals really try their best to do their job. And
Mhm.
I would say that generally doctors and nurses don't want to, or don't purposely disregard anyone's pain. And that,
Yeah.
from what I've experienced, that we do really try our best to attend to everyone as much as we
Mhm.
can.
Mhm.
Um, but the facts are there that ethnic women die earlier, or
Yeah.
their symptoms go undiagnosed or completely missed.
Yeah.
I think a lot of it also has to do with just language. So, for example, in Bangla, the
Yeah.
way maybe in our language that we describe certain symptoms for. So, for example, so I worked in like I work for a charity called Selfless, and we go to different villages in Sylhet. So,
Mm.
what you were saying earlier, in a
Big
lot
up.
of places that have difficulty accessing hospitals, and we
Yeah.
set up free healthcare clinics for people to come. And a
Amazing.
lot of times when women came, they explained their symptoms in a way that maybe doesn't translate properly to English. So, for example, we say something like, uh, how do you, so in Bangla, it will be like, uh, it's not gatu gatse, it's like, um, it kind of translates to my body is burning,
Okay. Yeah. Yeah.
or
Yeah.
like
Yeah. Yeah.
"Hindi kotte se," something like that.
Yeah.
And
Yeah.
it translates to like, it's kind of like they're ants. I can feel like ants, or my
Yeah.
body is
Yeah.
kind of
Yeah. Yeah. Yeah.
burning.
Yeah.
And
Mhm.
if that's hard to translate in English. It will come
Yeah.
across as like there are ants in my body, or my
Yeah.
body is burning. And that's not one of the symptoms that healthcare professionals are like, okay, I can treat you with this.
Yeah.
Um,
Also, another thing as well. Sorry to have just cut you off, but
okay.
there was another thing as well where I saw there were like renewed initiatives, basically because where the NHS have tried to like, or the organizations have tried to, include Bangladeshi women within the fold of like, like healthcare education and stuff, they've always done things in the Bangla language, but obviously they don't realize like Sylheti and Bangla are two different languages, and they're not exactly mutually intelligible either. So a lot of Sylheti people don't know actually how to speak Bangla. So
Mm.
they'll obviously put in so many like so much effort and invested a lot of like resources and stuff to do these educational initiatives, and it just ends up failing because these Sylheti women, they don't understand. So yeah, I think in
Yeah.
terms of that language sensitivity, that is like a big thing that is often like people just don't foresee it. Um
Yeah, I completely agree. Even our doctor is in Bangla because our doctors speak in Bangla, and we haven't
yeah.
done any sessions in Sylheti, for example.
Mhm.
But see, that's like another example of how maybe we're not. So the women that do attend ours, they most of them are Sylheti and they happen to
Mm.
understand Bangla. But surely there's loads of women that find it
Yeah.
difficult to communicate, or they don't understand Bangla because it's a
Mhm.
completely
Mhm.
different language. Like
Yeah.
I don't understand any Sylheti,
Yeah.
and you would a lot of people kind of think that maybe that there's some sort of like overlap,
Yeah.
but there really isn't.
Yeah, yeah, yeah. They're very different languages, and it's difficult, I think,
Yeah.
as well, because I mean, this goes back to what you were saying before, like in terms of recruiting people to join in. It's not as though you can just make a Twitter account and that's it. People know because the Black Bengali community, Bengali society is not very bureaucratic at all. Like it's very, very informal. That people don't
Mm.
necessarily kind of they're not necessarily in the habit of like signing up to things and doing things in terms of like documentations. People are do things like word of mouth.
Yeah.
So to get that word out, I understand like like
Yeah.
it would be quite difficult to reach certain kind of like aspects of a community in that way.
Yeah, and I think that's also why it's so important to have healthcare leaders and more doctors and more healthcare professionals from ethnic minority backgrounds,
Yeah.
because often that's the only way that patients will engage, or they'll
Yeah.
feel comfortable to
Mhm.
come to
Mhm.
you. And also, I think like for example, me being a Bengali doctor, I understand kind of the cultural context of people's health
Mhm.
needs and
Mhm.
sort of their health problems that maybe a white doctor won't be able
Yeah.
to
100%.
really understand. And so that's why I think it's really important to kind of, so going back to like the health pioneers and their project of kind of engaging more young people from East London, of most of them are of ethnic minority backgrounds, to think about going into medicine or sort of leadership roles, because you need people like that in the community
Yeah.
to engage everyone else and make sure that everyone else is being looked after.
I think as well, it's just important really to think about how healthcare is first and foremost, it's a very like community endeavor, right? Like and doctors
Mhm.
are, I guess in some ways you can say, like philanthropists. Like we need to, it's not just a case of like science and scientific research and medical research. You have to be very, very community focused. You have to be very, very community sensitive. And I think that's like a brilliant, amazing thing that Amar Doctor does. It's noticed, and it's looked at this, this niche where Bangladeshi women are obviously, like you said, are being underserved, and there are so many like socio-political kind of markers that underpin that specific thing. And you've gone and you've done this amazing thing, and as a Bangladeshi woman, like I didn't know you personally before this, but like I was already like I,
Mhm.
I remember seeing it during the pandemic actually, because I was going to sign my mum up to one of the things. um and I remember seeing it and I was like, this is actually sick. Like it's sick because as someone who also really cares about the women in our community, this needed to happen, and I'm so proud and I'm so happy that you've done it, and I'm like rooting for you guys completely. We have to wrap this up, but just before we do, I just wanted to ask, what is the future of Amar Doctor? Like where do you envision this going?
So we're hoping to continue doing our workshops for women, continue growing our community. So, like I said, we have like a small little community of maybe like 80 women on the WhatsApp group, but hoping to expand that. And we're hoping to not just engage women in the UK, but in other countries as well that are
Mhm.
interested in learning
Mhm.
about their health. And hopefully we will do some face-to-face sessions and face-to-face, like maybe like pop-up health clinic sort of
Yeah.
things as well. Hopefully when COVID gets a little bit better and it's safer to do that, because the
Yeah.
last thing I want to do is to put people in danger. But
Hmm.
that's the goal. I just hope more we can get through to more women that need to learn a little bit more about their health. And I hope that people sort of start to change their mindset that
Yeah.
they're also important and they need to look after themselves and put themselves first.
Rafia, I will say, so so my dad is actually like the chairman. My dad is the chairman of like the Greater Manchester Bangladesh Association. So he's basically like the chairman of all the Bangladeshis in the northwest.
Yeah.
So if you wanted to, like, you should definitely, like, I could get you in touch with him, and you guys could, like, it will be very, very easy for him to sort something out, like if you wanted to like branch out into the northwest and something like that. But I mean, we could message about that like behind the
I
scenes.
would love
But
that. Yeah,
yeah,
sounds great.
And for anyone listening that wants to maybe get involved in Amar Doctor, how can they do that?
So I mean, the best way, so what I've done is kind of ask people to just message me directly,
Mhm.
or, reach out to me on social media. But of course, if they don't have social media, they can literally email me, message me, text me, and I will respond to everyone, individually.
Sure. So what are your social handles and email?
So they can find me on Twitter. So I'm Rafia, Rafia underscore Miah, or they can call me directly. I can send you my details later.
Okay, brilliant. So yeah, if you guys don't have social media and you want to get involved, you want to get in touch, you can go through Mango Masala. Just
Yeah,
send us a
yeah.
message and we'll forward.
Yeah,
Because
perfect.
safeguarding issues, she's not just gonna give out her phone number, but
Yeah, yeah, obviously. Yeah, yeah.
yeah. So thank you so much, Rafia. Thank you so much for
Thank you
coming
for
on.
having me.
Thank you so much for doing this in the first place, for doing Amar Doctor. Like I said, like it's
Okay.
amazing. I'm so proud. I'm so happy that you're doing this. And I hope you just continue to be able to make impact in the community, because it's so needed.
Thank you very much for having me.
And good luck with everything.